This is a good day that we're ending the blanket ban.
A ban that's blocked gay and bisexual men from sitting down and simply donating their blood for 3 decades.
30 years ago.
For some, this was an emotional moment.
Today, I learned and was affirmed that my blood is as good as anyone's blood in this room.
Once rooted in fears over HIV, advocates fought for years to drop the ban, arguing the policy was outdated, discriminatory, and violated human rights. In 2015, the Liberals promised to get rid of it.
They pushed, we pushed, and it's been heard.
When you know what it is to be discriminated against, to live with that discrimination, to bury it deep inside you, every day like this is a magnificent day.
Health Canada is now allowing Canadian Blood Services to scrap questions about gender or sexuality. Current questions exclude men who've had sex with men in the past 3 months from donating. But not everyone is convinced the new questions will fix the problem. Lawyer Gregory Coe is leading a human rights case against the policy.
This is not a full end to the ban.
By the end of September, Canadian Blood Services says all donors will be asked if they've had new or multiple sexual partners in the past 3 months. If they answer yes, the next question is what type of sex they engaged in. If the donor checks anal, they will still be excluded.
The way it is framed is along the lines of sexual activity, which map on very closely to the sexual activities practiced by gay and bisexual men.
Canadian Blood Services says its questions are based on scientific evidence, and its goal is still to protect the safety of Canada's blood supply.
So why the focus on anal sex? Because the evidence is very clear that anal sex is still a significantly higher risk factor for transmission of diseases such as HIV than is vaginal sex or oral sex.
Other countries, including the UK, are implementing similar policies. Canadian Blood Services insists the questions will no longer target gay and bisexual men.
We recognize that for some people this may not be how they wanted it to unfold, but it is absolutely a much, much more inclusive process.
Okay, so Christine, this is a Canadian Blood Services change. It doesn't apply to all Canadians, right?
That's right. It does not apply to Quebec, but HEMA Quebec, which oversees the province's blood supply, says it's welcoming Health Canada's update. And while most of the country will see changes by September, Quebec has its own plan. So the blood ban won't lift there until sometime next year. As for why these long timelines, why it's going to take so long to make these changes, Canadian Blood Services says it's going to take time to update its surveys, and it has to retrain 1,600 staff. And as we mentioned, a similar change was made in the UK, and they found bringing in all those changes and having things run smoothly took about a year.
Okay, Christine, thank you.